Hi everyone, welcome to researchmd.com. We got a great topic today. Today we're going to teach you all about carpal tunnel syndrome. A great topic. Again, my name is Pramil Cheriyath. I'm a director of research. I'm also a program director, internal medicine residency, transitional residency, and I'm also assistant professor of medicine at Hackensack School of Medicine. So let's get into our topic. So what is carpal tunnel syndrome? It's actually compression of the median nerve on your wrist. When it goes through the carpal tunnel, it's at the wrist, and it causes numbness, tingling at the thumb, index finger, and the middle finger. Okay? So we got a nice picture over here. Kind of tell you the distribution, where the median nerve supplies, that's where your symptoms you're going to feel. So mainly it's on the thumb, index finger, middle finger, and have one half of the your ring finger. Okay. Now let's look at the epidemiology. Usually between the age around 40 to 60 years, that's where people usually get the symptoms, and it's 3 times more common in females. Remember that. So if you look at the pathophysiology of carpal tunnel syndrome, carpal tunnel syndrome is a tunnel at the palmar aspect of the wrist, and the median nerve is affected. And it's also, when you look at the carpal tunnel, 8 flexor tendons go through it, and flexor pollicis, longest tendon, also go through that. Okay, so because of the compression of the median nerve, you're going to have pain, numbness, tingling, paresthesia, and all the distribution of the median nerve distal to the wrist, thumb, index finger, middle finger, and radial half of the finger. Now, if you look at the carpal tunnel pressure, if you measure, the normal pressure is around 3 to 5 millimeters. What are the risk factors for for carpal tunnel syndrome? One is obesity, and the other one is like reparative motions at the wrist. A lot of other risk factors also, not as predominant as the other one, like perimenopause, rheumatoid arthritis, older age, diabetes, fluoroquinolone use, pregnancy, chronic kidney disease, amyloidosis, thyroid disease, acromegaly, lupus, multiple myeloma, sarcoidosis, and all of this can cause carpal tunnel syndrome. Now, how do you diagnose it? There's a couple of tests you can do. One is the Fallon test. So what you do is, like, you take your wrist and hold it like this in a fixed flexor position. That's what we call. And you hold it for 1 minute. And then if you started having this numbness and tingling on the median nerve distributions, it's like your thumb, index finger, middle finger, and then pretty much you got the carpal tunnel syndrome. Okay, so you hold your wrist in a fixed flexor position like this for 1 minute, and then you can feel the symptoms in the median distribution nerve. Okay. And there is something called a Tinel sign also. You hold your hand like this and you tap on the median nerve. You will feel electrical shock along the distribution of the medial nerve. There's 2 important tests you need to know to diagnose carpal tunnel syndrome. You can also do nerve conduction study. There's needle EMG you can do. Carpal tunnel ultrasound is the other way to check. What is the treatment for carpal tunnel syndrome? There is non-operative management and the operative management. In the non-operative management, you got the splinting. You wear this long splint, and you wear it for 4 to 12 weeks. Usually you wear only like at nighttime also, because your nighttime symptoms are like much common, much more. And then the other thing you can do local steroid injection, but that is also a temporary measure. You can also do oral steroids, and that also have like some effect. Then you have some alternative treatments like yoga, and you can also like acupuncture, which we'll talk about in another presentation. Now, what is the operative management, and when do you decide you need this operated, right? You do like 4 to 6 months of non-operative management and it doesn't improve, then you should consider surgery. Other thing is the continued axonal loss or denervation of the electrodiagnostic studies, and then also you should consider surgery. Thank you so much for watching. Again, carpal tunnel syndrome is a compression of the median nerve. Always remember obesity, pregnancy, and all of the symptoms. Those are the risk factors for carpal tunnel syndrome. There is non-operative management, And if the non-operative management 4 to 6 months and it failed, you should consider operative management. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. It would definitely help us to make greater presentations. Thank you.